Here's my audience for speech two. All right. Does anyone know of anyone with Hunter syndrome? Okay. Well, I'm here to inform you about complications, managing, and the effects of Hunter syndrome on people. My brother had this illness and died at the age of 16. They said he wasn't supposed to live until 6 years old, and then he was supposed to die, but he lived to see 16. Um, Hunter syndrome is a serious genetic disorder that primarily affects men or males. The women are carriers of this genetic disorder, and they pass it on to their boy offspring, their male offspring, whatever. So, today I will inform you about Hunter syndrome, the effects, signs, symptoms, and managing this disease. Let's start by giving the clinical definition of Hunter syndrome. Hunter syndrome is a rare genetic disorder that affects physical and mental progression in male genders. There are rare cases that affect women, but there's so little, so they don't understand why some of the women got that. It is an X-linked disorder, meaning that it's transmitted from the mother to her children. It occurs in about 1 in 100,000 or 1 in 50,000 in men, and this is mostly all men. There are two types of Hunter syndrome, type A and type B. Type A is the more severe one, which is seen earlier in stages of life than in type B. Type B, you mostly find it in their adult life after they've gone on and then later on have complications of that. Some of the physical symptoms of this disease is they have a large, prominent forehead. They have enlarged abdomens. They're short in stature, so it almost reminds you of a little bit of like dwarfism, a little bit attached with this disease. Mental symptoms of it. It leads to mental retardation and also developmental delays. So now that you know some of the information about the nature of Hunter syndrome, I'll help you out by knowing some of the things that people are suffering from the illness. Some of the treatments of this disease is the palliative treatment. This reduces the deterioration of the actual muscles that are being deteriorated during this disease, as well as surgery. They also have bone marrow grafts, which have helped in also slowing down the deterioration, or actually the process of this disease, but it's painful and it can be life-threatening to the child as well. Just recently, looking up on the internet, I found that they have this medication called Dorsalfix, which is a new medication given intravenously to patients, and that's also shown to help in the reduction of the process of this disease. Growing up, it was hard for me to go to school because my brother also went to school, so I would always have to stick up for him, or I always have to say something to somebody or have an attitude because somebody was always looking at my brother. So I'd be like, well, if you want to know what's going on, how about you ask instead of looking at my brother? So I had a little attitude growing up, especially around that, because even though he was the older sibling, I was the one that stood up for him. And treating this disorder, being able to manage it is needed also. So managing it is, you can go to genetic counseling as recommended for parents that if you have a sibling for it, which I did. So since my brother had this genetic disorder, I went to genetic counseling once I found out that my son was about to be born 6 years ago. Yeah. And other things, if someone in your family has a disease, they want you to also try to go and look up stuff for yourself, because when I was growing up, a lot of people didn't know a lot about Hunter syndrome. So we went in the area and went to Specialty Children's Hospital, CHKD, which is right in Norfolk, and they did a genetic testing on us, everyone in the family. They gave funding for the cost of it because my parents were teachers at the time and really couldn't afford the treatment, so they offered grants and different things for that. A good way to help in the managing of the disease is to also find a specialist or a hospital experienced and supportive of this disease. stay informed of the medical process, and find other families that have this disease, because you can form a bond and they can help in you actually understanding what's going on with your child. As we have seen, Hunter syndrome affects thousands of families. Fortunately, there are treatment options for people to slow down the effects of it, which we've seen, the medication, the bone marrow grafts, and other things. In my case, there was not a lot of information for Hunter syndrome, so the medicine that's out now wasn't out for my brother. So that was kind of heartening, because I'm like, well, now they have it, but if they would have had it back then, maybe he could have still been alive today. Because of this illness, I have a better understanding and appreciation for life and other families and that have sick members in them. Thank you for sitting here and watching my speech, and thank you.
Did you just?
Yeah.